Hey, good afternoon, everybody. This is Brittany Jennings coming to you live from Seniors Blue Book. And as you can see, I am outside of, or maybe on Zoom behind me, is we are with Encompass Rehabilitation today. Hi, Jonathan. How are you?
I'm doing well. How are you guys today?
Doing awesome. Thank you so much for joining us. It's such a pleasure to meet you virtually. Of course, I've heard so much about you, and Encompass Health and Rehab has an amazing reputation in town as being known as really like the best of the best. So I'm excited to talk to you and get to know you a little better. And then we're going to get to kind of all the different services and therapy disciplines, things like that happen over at Encompass.
Awesome. I look forward to it.
So tell us, Jonathan, a little bit about yourself and your background.
So weirdly enough, I actually got involved with therapy as a whole, working with people with developmental disabilities. I worked with like range of motion, and I kind of got really interested in working with physical therapy and occupational therapy. And then I had the choice to make which direction I was going to go with OT or PT, occupational physical therapy. So I did the physical therapy route. So my background's in physical therapy as an assistant. And then I ran an outpatient aquatic therapy clinic, and then I got back in the hospitals and just fell in love with the incredible outcomes that the acute rehab setting has. And my passion just kind of continued to grow. And then now I get to fight with insurance, I get to fight with doctors, everyone, to bring them into our setting so they can see the amazing outcomes that we have from these hospitals. It's incredible.
Absolutely. And kind of while we're on that topic of being a hospital and being a rehab, tell us a little bit how that's different from, say, a skilled nursing facility.
Yeah, that's a really great question. And so my go-to is always, no one really knows what an acute rehab is until they need it. And then when they need it, they sometimes don't even know that they fit that criteria for needing it. So there's two really big differences. So a skilled nursing facility, as they operate, doesn't have a requirement for the amount of therapy that they give patients. So all of them could be different. You may have one that gives 20 minutes. You may have one that gives 30 minutes a day. With COVID, it could be even more limiting than that. And then for our licensure for therapy, for physical occupational therapy, we are required by law to do 3 hours of therapy a day with our patients. Sometimes that can be a little modified to ramp up to those 3 hours, but that's what we work towards under our licensure. The other piece of that is the amount of physician oversight. So because we do operate as a hospital, we have like consulting physicians. We have a PM&R doc, a physical medicine rehab doc that overlooks your care while you're here for labs and imaging and stuff. So at a skilled nursing facility, the requirement for a doctor to see you is once a month. Where at our hospital, the doctor has to see you 3 times a week, at least. Sometimes it's more depending on what type of care you need.
And so when we talk about the admitting process, so if, because I know I used to work with you guys a lot when I was in assisted living, and we had, let's just say, for example, somebody who had Parkinson's and they had a decline. So we relied on you guys a lot. We would call your liaisons to come out and kind of, we call it like a tune-up or whatnot. Yeah. But talk about kind of some of the different environments that somebody can be admitted from to your hospital.
So there's really no limited, that's the good part, there's no limited environment. So we take patients from home, as you mentioned, at assisted living, that's the resident's home. So we take them from home, we take them from out in the community in their like single story, multi-story home. We can take from patients from skilled nursing facility. A big bulk of our patients come from the acute hospital. So you think of after an immediate injury or anything, they come from there. But realistically, for us, a lot of our patients come from home as well. As you mentioned, a lot of them need a little bit of a tune-up to get a little bit stronger, to get your independence a little back. So yeah, we come from pretty much anywhere.
That's awesome. I do remember too, even when I worked previously helping people find whatever type of care they needed, I had a few people we would call and set up right from their home, and they would be admitted. And it's just wonderful that there's no limitation on that. It's super special. So the next thing I want to talk about is just the different type of therapies that you do offer there at the rehab.
Yeah, so our 3 big ones obviously are occupational therapy, physical therapy, and speech. So let's just start with physical therapy, because that's where the world that I came from. We like to work on your mobility, so your some of your balance stuff, lower extremity, so your leg exercises and strengthening. Big thing is walking. So we have like parallel bars and different assisted devices to get you stronger. So your physical therapy will work on walking, maybe some stairs, that type of stuff. And then occupational therapy as a practice started working with people as occupations. How can we get people back to their, what they did for a job or what they enjoy doing as a hobby? So our occupational therapists are really great at adapting whatever their therapy is going to be towards what your hobby is or what your job is. If you need to work on your balance a little bit because you're standing at a cash register all day and you've had a stroke, we work on your standing balance while doing other activities. It could be with a computer or something that will be similar to a cash register. Our occupational therapists also deal with, your bathing, dressing, grooming activities. So all of our patients get dressed every single day. That way we can see if there's any deficits there. And then our speech therapists work on stuff like swallowing, word finding issues, or maybe a little like cognition, like if maybe you've had a stroke and you're confused a little bit, we kind of help you sort through that. But the big thing for them is the swallowing. So if you're having trouble swallowing, we have different therapies for that as well.
Awesome. And so are there any specific diagnosis? I know it's when somebody gets admitted, there has to be a specific diagnosis or different types of therapies that are required. So can you talk a little bit to that?
Yeah, that's a great question. But so we can cover a large basis. So a part of what we need to prove to bring someone in is that you need oversight from you, that you need the physician oversight at least 3 days a week, and that you need the therapy. I'm gonna be honest, I can prove that pretty much anyone needs therapy because we all have some balance stuff going on. We all can get a little bit stronger here and there. The other piece of that is the physician oversight. So as you mentioned, with someone who has Parkinson's disease, maybe they're having a little exacerbation or a med change. With multiple sclerosis, same thing. Maybe they're having a med change. Strokes, let's say, these are all common diagnoses that we see. So I mentioned them. If they maybe have some hemiplegia is what they call it, when they're completely weak on one side, we can bring them in for a tune-up. But really, we cover the gamut of anything you can think of, as long as there's something that needs to be managed by a physician, and then that there's something that we can do to get you stronger.
Definitely. And about what's the average length of time that somebody would come and stay with you? And I know everybody's individual, but what would be the average?
So our average length of stay is about 10 to 12 days. And that is in comparison to a skilled nursing facility where patients are usually there about a month or longer, which some people want to be somewhere for a month or longer. But if you think about wanting to get home, and that should be everyone's goal is wanting to get home, those 10 to 12 days, we get people in and out, we get them stronger because of the 3 hours of therapy every day.
Awesome. And the next thing I want to mention is you guys are expanding. I actually live just a few minutes away, so I've seen there's some construction going on. Can you give us an update on what you guys your current beds, and then what you're expanding to?
Yeah, so we're currently at 89. Well, currently we're 96. We have some beds shut down because of the construction. So we're going to be we're in the process of adding 20 more beds and expanding our parking lot. Because we had 96 beds, and our parking lot was a decent size, but family obviously loves to come and visit. Family members were in there when they're in the hospital, and our patients they thrive on seeing some of their family members. So we added a bunch of parking as well for those extra beds, so family can come and visit and friends can come and visit.
Awesome. Is there kind of a target date that you guys I know construction's kind of, is there like a hopeful date that it'll be completed?
I'm hoping by the end of the year. That's me. That's me.
Awesome. Yeah. It's a good way to start 2021, right?
Right. Yep.
It almost feels weird to say that, right? 2021. Can you believe that?
No, I think 2020 has been, because of COVID. I was just talking to someone maybe 10 minutes, 15 minutes ago, and it feels like it's been a long time and it's been a short time. It's been the weird year where it feels like January was like 2 years ago, but it also feels like it was like yesterday. That's the weirdest. I've ever had a year like this.
I know. I completely agree. It's been new territory for everybody. How has everybody, the staff, the doctors, how's everybody kind of come together there to, during this time, during the last, let's say it's now been 6 months. So how have things been a little bit different there?
Yeah, so I want to start with a big shout out to all of the hospitals, everyone in healthcare, because I feel like this is a really good telling sign of the state of healthcare, at least in Sarasota area, in Florida too. Everyone is just so patient-centered that the communication between hospitals has been really great. The communication between staff internally and, as I mentioned, other hospitals has been incredible. So following suit with that, our internal staff, great communication amongst each other, but we also have some of our nurses and our CEOs are on calls with like the CDC for guideline updates, and we communicate that internally. We have an ever-changing, I say ever-changing because guidelines seem to be very fluid with the way that we are supposed to operate. So we started to open up some of our visiting hours again, which has just been incredible for family members. But I really feel like everyone kind of came together and said, what can we do? What's best for our patients? If anyone is watching and you see behind Brittany, that first floor of our building, there's windows and those are patient rooms. So what we did is we put the room number on the outside of those patient rooms. So family, this was before people could visit. We would have the family come to the window and our nurses would help the patients talk to their family members, which is super sad with the state of 2020, but it was so uplifting for our patients to see their family members. So I think that it just is a tell of what our internal staff also wants to do for our patients and the therapy department as well.
Absolutely. Now, so as of now, because things have changed for some of our senior living communities, where are you guys at with families visiting, with that sort of thing? Is it still shut down at the moment because you're a hospital?
No, so we have visiting hours depending on what floor the patient is on. We have visiting hours depending on that day. For both floors, it's between 12 and 1 and between 4 and 5. But on the first floor, it's Monday, Wednesday, Friday. Second floor, it's Tuesday, Thursday, Saturday. And so the reason why it's between 12 and 1 and 4 to 5 is we don't want any therapy interrupted. We want to make sure that they're still getting their therapy in because a lot of the hospitals are still shut down to visitors. And I think that the family would love to come in as a whole and just, shower their loved ones with all the attention and love that they deserve. So we do need to limit it. And then we also are limiting just to one visitor that day. So they can come at 12 to 1 and 4 to 5, but it has to be the same person.
Absolutely. Well, I'm just happy to hear that they're able to come in and visit their loved ones at such a time where they need that uplifting, they need that motivation to be able to get those 3 hours of therapy. That's quite a bit for if you think about your average, age of your patient, but think about yourself too. Like, can you imagine somebody pushing you to do 3 hours a day of exercise?
Yeah. So I always tell people it sounds like it's a whole lot, but it is spread out throughout 8 hours a day. So the key to that is it's 3 hours of therapy, but that includes stuff like your bathing, your dressing, your grooming. That includes just walking. So what we really try and do is take that 3 hours and recreate what a normal day would look like for that patient. So if they get up at 7 o'clock and they take their shower and they get dressed, that's what we try and mimic the best that we can. And if then they go for a walk or something, we try and really shape whatever that patient likes to do and when they do it. So when they go home, we've covered all of our bases. So we even have the front end of a car that raises and lowers in our gym. We have an apartment, we have a bathtub, we have a kitchen, we have a mobility lab outside that has like a ramp and steps and curbs. So anything that a patient would need, we try and address it before they get home, included in that 3 hours.
Yeah, when you think about it or you put it in terms like that, that is definitely like, because, sometimes it can take an hour to get ready in the morning,
Yeah.
and I mean, it takes me an hour and a half just to do my hair. So I'm just kidding. You as well, right?
Yeah, I'm saying.
So, well, I appreciate all the information you're sharing. You're such a great resource and amazing. You're an amazing team. I saw Amy is watching and she said you guys have the best team, and you really have one of the best teams around. And I'm so proud to have you so close to us for us to be able to refer people for rehab too. So thanks for everything you're doing over there.
Yeah, thank you guys too. Absolutely.
Awesome. Well, everybody who tuned in, thank you so much. Again, this is Jonathan. He's with Encompass Health and Rehabilitation. If you have any questions for him, Jonathan, I'll put your contact information on the post and all the information for Encompass for people to reach out to if they would like information for themselves or their loved ones.
Wonderful. Thank you so much for having me. I appreciate it.
Absolutely. All right. Well, have a great day.
You too. Thanks.